Hey everyone, and welcome back to the channel. Today, we're re-diving into a topic that's been gaining a lot of attention in the medical community, the recognized health benefits of marijuana. It's important to note that this is for informational purposes, and you should always consult with a healthcare professional before considering any new treatment. Let's get started. First up, one of the most well-known benefits is pain relief. We're not just talking about a minor headache. Marijuana has shown significant promise in managing chronic pain, especially the kind that's notoriously difficult to treat, like nerve-related pain. Think about conditions such as severe arthritis, the tingling and burning of neuropathy, muscle spasms from multiple sclerosis, and even the intense pain that can accompany cancer and its treatments. So, how does it work? Our bodies have something called the endocannabinoid system. You can think of it as a complex network of signals that helps regulate various functions, including our perception of pain. The active compounds in marijuana, known as cannabinoids, interact with this system. They can essentially help to turn down the volume on pain signals that are constantly firing, offering relief where other medications might fall short. It's this unique interaction that makes it a focus of so much research for chronic pain management. Next, let's talk about nausea and vomiting. This is a particularly challenging side effect for many people undergoing chemotherapy. The constant feeling of sickness can be debilitating. Here's where cannabis has been a game changer for many. It's incredibly effective at reducing that nausea. In fact, its effectiveness is so recognized that there are FDA-approved medications derived from cannabis specifically for this purpose. For example, a drug called dronabinol, which is a synthetic form of THC, is often prescribed to cancer patients to help them cope with the harsh side effects of their treatment. This allows them to feel better and maintain their strength during a very difficult time. Another closely related benefit is appetite stimulation. When you're dealing with a serious illness, losing your appetite is very common, but it can lead to dangerous weight loss and weakness. This is often seen in patients with conditions like HIV/AIDS or those undergoing cancer treatments. This severe weight loss, sometimes called wasting syndrome, can seriously complicate recovery. Cannabis is famous for inducing what many call the munchies, and this effect can be a therapeutic lifeline. By stimulating the appetite, it helps patients eat more, maintain a healthy weight, and get the nutrients their bodies desperately need to fight their illness. It's a simple yet powerful effect that can dramatically improve a person's quality of life and overall health outcome. It's truly fascinating to see how a plant that has been around for centuries is now being scientifically validated for its various medicinal properties. From managing debilitating pain to helping patients get through tough treatments like chemotherapy, the applications are broad and impactful. The research is constantly evolving, and scientists are learning more every day about how the different compounds in cannabis work and how they can be best utilized for health and wellness. Of course, it's not a one-size-fits-all solution. It comes with its own set of considerations and potential side effects that are important to discuss with a doctor. And that's a quick look at some of the key medically recognized benefits of marijuana. It's a complex topic with a lot more to explore, but hopefully this gives you a good overview. If you found this information helpful, please give this video a thumbs up and hit that subscribe button for more content like this. Thanks for watching, and we'll see you in the next one. Hey everyone, and welcome back to the channel. Today, we're re-diving into a topic that many of you have asked about: natural ways to find relief from some really persistent and challenging conditions. We're going to explore how specific compounds, particularly those found in plants like cannabis, are being researched for their potential to help with muscle spasms, sleep issues, and even anxiety. It's a complex subject, so let's break it down together. First up, let's talk about muscle spasms and stiffness. For people living with conditions like multiple sclerosis or MS, daily life can be a constant battle against their own bodies. Muscles can become incredibly tight and go into spasms without warning, which is not only painful, but can severely limit mobility. Imagine trying to walk, hold a cup, or even just sit comfortably when your muscles are uncontrollably contracting. It's exhausting and frustrating. This is where the conversation around cannabinoids like CBD and THC gets really interesting. Research has shown that certain cannabinoid-based treatments can be effective in reducing muscle spasticity. How does this work? Well, our bodies have something called the endocannabinoid system, which helps regulate various functions, including muscle control. The compounds in cannabis can interact with this system, helping to calm overactive nerve signals that lead to muscle stiffness. For some individuals with MS, this has translated into a noticeable improvement in their mobility and a significant reduction in discomfort. They find it easier to get through their day, perform simple tasks, and just feel more in control of their bodies. This isn't a cure, but for many, it's a valuable tool for managing their symptoms and improving their quality of life. Now, let's shift gears to something that affects nearly all of us at some point: sleep. Or, more accurately, the lack of it. Whether it's insomnia, where you can't fall asleep, or sleep disruptions from things like chronic pain, a bad night's sleep can ruin your entire next day. You feel foggy, irritable, and just not yourself. When this happens night after night, it takes a serious toll on your physical and mental health. Again, this is where low doses of certain compounds are being looked at for their potential benefits. Specifically, some studies and a lot of anecdotal evidence suggest that low doses of THC, the psychoactive component of cannabis, can help people fall asleep faster. For those who lie awake for hours with a racing mind, this can be a game changer. Similarly, for people whose sleep is constantly interrupted by chronic pain, the pain-relieving properties of cannabinoids can help them stay asleep longer, allowing their bodies to get the deep, restorative rest they desperately need. It's about creating a window of comfort that allows sleep to finally take over. Finally, let's touch on anxiety. This is a big one. From the dread of a social gathering to the constant hum of general anxiety, it can feel like a cloud that follows you everywhere. It can make you second-guess yourself, avoid opportunities, and steal the joy from everyday moments. Many people are looking for alternatives to traditional medications, and that's led to a surge of interest in CBD-focused products. CBD, or cannabidiol, is a non-psychoactive compound found in cannabis. Unlike THC, it doesn't make you feel high. Instead, many users report a sense of calm and well-being. Research suggests that CBD may help reduce both social anxiety and general anxiety. It seems to work by interacting with serotonin receptors in the brain, which play a crucial role in mood and anxiety regulation. For someone who gets nervous before a public speaking event or feels overwhelmed in crowded places, a low dose of a CBD-focused product might help take the edge off, allowing them to engage more confidently. However, and this is a really important point to stress, dosage is everything, especially with THC. While low doses might ease anxiety for some, high doses of THC can have the opposite effect. It can actually worsen anxiety and even induce paranoia. This is why the start low and go slow approach is so critical. Everyone's body chemistry is different, and what works for one person might not work for another. It's crucial to be mindful and cautious. So, to wrap it all up, we're seeing a growing body of evidence that the compounds in cannabis can offer real therapeutic potential. For a range of issues, from improving mobility for those with muscle spasms, to helping people get a good night's sleep, to easing the burden of anxiety, it's a powerful reminder of how complex and amazing the natural world is. Of course, it's essential to talk to a healthcare professional before starting any new treatment, especially if you have an existing condition or are taking other medications. They can help you navigate your options safely. Thank you so much for joining me today to explore this fascinating topic. I hope you found this information helpful. If you did, please give this video a thumbs up and consider subscribing for more content like this. Drop a comment below and let me know your thoughts or experiences. Stay safe, stay informed, and I'll see you in the next video. Hey everyone, and welcome back to the channel. Today, we're re-diving into a topic that's getting a lot of attention in the wellness world: the potential anti-inflammatory effects of cannabis. It's a complex subject, so let's break down what the current science is telling us. You've probably heard about the two main compounds in cannabis, THC and CBD. While THC is known for its psychoactive effects, CBD is non-intoxicating and is gaining a reputation for its therapeutic potential. One of the most promising areas of research is its role in fighting inflammation. So what is inflammation? It's your body's natural response to injury or infection. Think about a cut that gets red and swollen. That's acute inflammation, and it's a good thing. It means your body is healing. But when that response doesn't switch off, it becomes chronic inflammation, which is linked to a whole host of health problems. This is where CBD comes into the picture. Studies suggest that CBD may help regulate the body's inflammatory response. It interacts with our endocannabinoid system, a complex network of receptors that helps maintain balance in our bodies, including managing inflammation. By influencing these receptors, CBD might help to calm down an overactive immune system. This has led researchers to explore its potential for autoimmune conditions, where the body mistakenly attacks its own tissues. For example, some studies are looking at conditions like Crohn's disease and ulcerative colitis, which are inflammatory bowel diseases. The idea is that by reducing gut inflammation, CBD could help manage symptoms. Similarly, for conditions like rheumatoid arthritis, which involves painful inflammation in the joints, researchers are investigating if CBD can offer some relief. Early findings are encouraging, but more large-scale human trials are definitely needed to confirm these benefits. Beyond general inflammation, the conversation often turns to neuroinflammation, which is inflammation in the brain and nervous system. This is a key factor in several neurological disorders. One of the most well-researched areas is epilepsy. In fact, the FDA has approved a CBD-based medication, Epidiolex, for treating certain rare and severe forms of epilepsy. It's been shown to significantly reduce seizure frequency in these patients, which is a life-changing outcome. The potential benefits don't stop there. Research is also underway for Parkinson's disease. While it's not a cure, some studies suggest that cannabis-derived compounds might help manage non-motor symptoms like anxiety and sleep problems, and potentially reduce some of the inflammation associated with the disease's progression. It's a fascinating area of study that could offer new avenues for supportive care. Now, it's crucial to have a balanced conversation and talk about the realities and risks. The benefits we've discussed are primarily associated with controlled medical use of specific compounds, often CBD dominant and taken under professional guidance. This is very different from heavy recreational marijuana use. Using marijuana, especially high THC strains, comes with its own set of risks. These can include the potential for dependency, short-term memory impairment, and for some people, increased anxiety or paranoia. The effects can vary widely from person to person, depending on the dose, the strain, and individual biology. It's also important to remember the legal landscape. The legality of cannabis for medical or recreational use varies dramatically depending on where you live. What's legal in one state or country might be illegal in another, so it's absolutely essential to know your local laws, and most importantly, to consult with a healthcare professional before considering cannabis for any medical purpose. They can help you understand the potential benefits and risks as they apply to your specific health situation and guide you towards safe and legal options. Self-medicating without professional advice is never a good idea. In summary, the science around cannabis and inflammation is incredibly promising, especially when it comes to CBD. From autoimmune conditions to neurological disorders, the potential for new therapies is exciting. But it's a field that's still evolving, and we need to approach it with a healthy dose of curiosity and caution. Always prioritize medical advice and responsible legal use. Thanks so much for watching today. If you found this video informative, please give it a thumbs up and consider subscribing for more deep dives into health and wellness. Let us know your thoughts in the comments below. Stay safe, stay informed, and we'll see you in the next one.